It's medical billing. We want to have a little fun. I don't always get sucked into a jet engine, he says. But when I do, I use ICD-10 code V97.33. Now, this is just to show you there truly is a code for everything. So all the different things you're wanting to build for medical, there's going to be a code to show that. There are even codes, as an example here, there's a code for, having an accident in a jet. But there's going to be all kinds of ICD codes for not only what condition the patient has, but how it happened. So keep that in mind. If you do have an accident case, this means ICD-10 code for falls, and they're specific to fall on the same level or fall from ladder or fall from playground. And so you will see that there's also codes to say what happened to a patient. So that's how important the ICD diagnosis codes are. I like to say the International Classification of Diseases code tell a story. They tell what's going on with the patient, what symptoms they're having, and in many cases, if it applies, how it happened. Now, the CPT codes would be the cross codes from your dental CDT codes, and that's going to indicate the treatment that you're doing, okay? Now, the ICD-10 is changed every year. As I mentioned, there were a couple of things that changed in October for those of us billing medical in the dental office. The one thing is the removal of the headache code, the head pain code that we all use so much. They added a few more TMJ codes. They, believe it or not, there was no diagnosis code for arthritis of the TMJ or arthropathy of the TMJ. And so those are codes added for that, which we'll show you. So these change every year. They do change in October. ICD codes, as I mentioned, they tell a story.